Hello everyone, I'm Sophie and I'm a 21-year-old student from here in Edinburgh. Today I've come to Vision Scotland to check my eligibility for laser eye surgery. Firstly, I had my eye health checked by the lovely Pauline. We went into a room full of equipment and I had numerous eye checks. One of them was checking the thickness of my cornea, which relates to eligibility for laser eye surgery, and we also checked my reaction time, which was probably my least favourite of the equipment. The procedure and checking for everything was so much quicker than I anticipated, and it was so easy, and everyone, especially Pauline, made me feel so welcome and so put at ease. Next, I went and visited Kat, the optometrist, and was able to see my results on the computer screen. She talked me through my eligibility and said that it all looked really good and that I'd be a good candidate for laser eye surgery.
Your cornea looks almost like a model cornea. Oh. It looks absolutely perfect, and there doesn't seem to be any indication of a risk of what we call corneal ectasia as you get older, which is when the cornea thins down and becomes very vulnerable. Yeah. Beautiful shape and nice and thick, so really, really good for laser eye surgery.
After seeing Kat, the optometrist, I was introduced to one of the consultants here at Vision Scotland, Jonathan Ross. He was able to answer all the questions that I had on laser eye surgery and make me feel very at ease. Here is what we talked about.
Okay, so Sophie, I'm going to summarise everything that you've been through so far in your assessment. You're short-sighted, right? So what short-sightedness means is that your distance vision is poor.
Yeah.
And has been for quite a few years now, and has been getting worse and then stabilised.
Yeah.
What that means in medical terms is that your eyes are just slightly bigger than average.
Yeah.
I mean, literally by 1 or 2 millimeters, but that's enough to make the difference. Yeah. And then the question that you're asking of us is, are you suitable to have that treated so that you don't have to wear glasses anymore, you don't have to wear contact lenses anymore. Just to summarise most of the things that we've looked at that are really important, your pupils are of a normal size, which would be fine to have treatment. The thickness of the front window of your eye, the cornea, which needs to be above a certain thickness, because we take a tiny bit away, is fine. It's nice and thick. Your age is on your side. This is kind of, I think anywhere in the early 20s is kind of ideal, because your eyes are old enough and mature enough to have treatment, but you're going to get loads of years of benefit from it. Yeah. Your prescription's in the right area. If your prescription's too small, there's limited benefit from getting treatment. Whereas if your focusing area is really big, then actually some of the other issues come into play which make us less comfortable doing laser eye surgery. But -3, which is about where you're at, is pretty much ideal actually. And we're also looking at we're looking at some scans which look at kind of how smooth the surface of your eye is. We're looking at how wet or dry your eye is. We're looking at how long your prescription has been stable for, and a few other things besides. And taking all of that together, you're a kind of very much an ideal candidate for laser eye surgery if you want it.
You mentioned that in the surgery you take away a small layer of the cornea. After doing this, is there any chance that as I get older, this layer could get thinner and thinner and pose a problem to my eye health?
Not really, no. As long as we, work within certain safe parameters. Okay. And that's exactly why we measure these things, because we know that if, for example, your corneas are quite thin before we treat you, and then say we do a lot of treatments, this isn't like a cut-off thing. It's not like if we go to a certain level of thinness, we're going to have problems. It's like that if we go to really quite a thin layer of window, a small proportion of people might have problems in the future, and we want to avoid that kind of thing. So we can treat you within a sort of a safety zone where we really have virtually no concern at all about what might happen in the future.
So you mentioned risks and obviously safety that comes with this kind of procedure. How much risk is there, and what should I expect?
It's a great question, and I think most people that come to me for this treatment are, they've been reading stories on the internet and horror stories about this and, this, that and the next thing. And those stories are definitely out there, and there is no doubt that all procedures have an element of risk attached to them, including this one. You will find people out there who will feel that it was a bad experience for them, right? But the true picture, which isn't really represented in the media, is that this is the most widely performed procedure in the whole of, not just eye care, but in the whole of healthcare on the planet. There are millions and millions and millions of these procedures carried out. Yeah. And the number of people who actually have problems is vanishingly small. A true kind of statistical context, it's about the safest medical procedure that exists. So not to say that it's completely safe, but the risks of coming to harm, if you are treated within safe parameters by experienced experts with, really good state-of-the-art laser equipment in a good centre with appropriate follow-up and communication about do's and don'ts, the chances of coming to harm is really, really, really small.
So you obviously have a lot of confidence in the procedure. Is this something that you would have yourself, or have you had it yourself before? One of the things I see in the media is that, why would you have laser eye surgery? It's risky. An eye surgeon would never have it done, right? So that's actually been studied across Europe, the research has shown that the eye surgeons are 4 times more likely than the general public to have laser eye surgery. So actually the reality is that my profession engages in laser vision correction very, very frequently. I personally, when I was growing up and when I was your age, had the same prescription as you. I was -3 as well. And for a good few years, I wore contact lenses and glasses because I was completely happy doing that. And therefore I saw no point in having laser eye surgery. But I think when I was in my late 20s, a little bit older than you, I started to get a bit fed up of just, the solutions and remembering the contact lenses and all the rest of it. And I decided that actually I wanted to not do that anymore. And I did have laser eye surgery then. So I haven't worn glasses or contact lenses now for about 20 years or thereabouts. And I can tell you all about my experience of that because I remember it like it was yesterday actually. But it was an amazing experience. And the thing that I kind of reflected on, in the time after that was that I just wish I'd had it done earlier. It would have been so much better because it's just, you have the initial euphoria of, wow, I can see without anything. And then it just becomes completely normalized. And the wow factor's gone because you're just used to just seeing, right? Which is great. I was -3, and there comes a discussion about, how long will it last for, right? Because it doesn't last forever in most people. And there are, I would say, broadly 2 reasons why. The first one is a thing called regression, which means that when we laser you, what we're effectively doing is taking the curved surface of your eye and we're making it a little bit less curved. We're making it a bit flatter. And that allows your eye to focus better. And what can sometimes happen over the years is that it goes a little bit more curved again, and you therefore start to become a little bit more short-sighted. That's happened to me a little bit now after 20 years. So I've gone from being -3 to being 0 after laser eye surgery, which meant that my vision was perfect. And I'm now nearer to -1, which means my distance vision isn't quite as sharp anymore, which is a disadvantage. But actually, there is an advantage in that too, which I'll come on to now,
which is that the second problem that can occur, typically starting in your 40s, but certainly into your 50s, is a condition called presbyopia. And in presbyopia, the muscles inside your eye that control near to distance focusing start to get weaker.
Oh, okay.
Which means that if we correct your -3 short-sightedness now and make you perfect for distance, and it stays like that, in say 25 years time, your near vision is going to start to get worse.
Yeah.
Something like that, okay. But if you've had regression, which I said before, and have drifted back to -1, that compensates for the presbyopia. So my near vision is actually better.
Yeah.
It's worse for the presbyopia,
Yeah.
but then improved upon by drifting back into -1. So there's a little bit of a trade-off there.
Yeah.
Okay. Now, as I go through the next 10 years, say through my 50s, I expect to get more of that happening. I expect to become more presbyopic, which means my near vision will get worse. I might need to wear reading glasses. But then if I get more aggression, again, that will offset that. And then I will get better near vision, but I might need to wear distance glasses.
Yeah.
So that all happens to everybody as a natural part of aging. But if you have laser eye surgery at the age of, say, 21, then the likelihood is you will get 25 to 30 years benefit before these issues come into play.
So if my eyes were to deteriorate as I get older after this procedure, is it something I can have again and would be fine to have again?
So if you need to be retreated at some point in the future, that can be done. You must go through all the same rigorous assessment again. Now, the first time we laser you, we do make the cornea a bit thinner, and therefore we need to assess whether making it thinner again is safe, but we will do that. Actually, because of the way that the eye has aged, you can tolerate more thinning, so we've got more freedom to play around with that a little bit. But the other thing is, of course, that when you are, say, in your 40s or 50s, there's a fairly strong likelihood that we may even be having a conversation with you about non-laser forms of treatment at that stage anyway, because there are other ways of correcting vision rather than just laser. Yeah. Laser we tend to use more for young adults. So we may be having a conversation about implantable contact lenses or lens replacement surgery, for example, instead of laser eye surgery at that stage.
Obviously, I like to go to the gym, go swimming, travel a lot. So how long after laser eye surgery can I return to normal life and those hobbies that I have and the things I like to do?
So you do want to give this, in terms of going back to normal day-to-day activities, more or less straight away. Your eyes can be quite sore for a day or two afterwards. And that might make you feel like laying low, but really the eyes heal very quickly. In terms of going back to more strenuous physical activities or non-clean activities such as being in a swimming pool, being in a potentially dirty environment, we would really probably want you to wait about 4 weeks so that the eye is properly healed and the infection risk is really absolutely minimal. Okay.
So this is something I'm quite nervous about. So I was wondering what kind of the risk of infection is.
It's very rare. Difficult to give you actual numbers because the infection rate is so low. But again, after surgery, you are given antibiotic drops. We keep a close eye on you in the early healing phase. If there is any problem at all looking like it might develop, then we're on top of that. But it's very rare.
So obviously you've spoken about how long it takes to get back to the daily life kind of thing. What about getting on a plane and going away? How long would I have to wait?
In theory, you can get on an aeroplane an hour after your laser eye surgery and go somewhere. But of course, the issue is that we want to have you close by in case there's a problem. So we would want you to stay around for a week or so just to make sure that we're happy with you.
So you mentioned implantable contact lenses. Is that something that would be an option for someone like myself, or would you favour laser eye surgery?
It is, so we are a centre that offers all treatment options.
Yeah.
And that's important because we don't want to feel obliged to lean on one and end up feeling obliged to offer a treatment to a patient where it's not really the ideal treatment for them. I mean, they're not strict cut-offs here. You can kind of treat more people in that area or that area if that's what you've got available. But we want to have all treatment options here so that we can say, no, that's definitely the best thing for you. That's what we're going to do. And for someone like you, I mean, you know, again, I've been through this myself. It's a great option for you. And I'm going to take myself back again to kind of in my 20s and being in your shoes. It's very nerve-wracking. You know, no matter what people tell you, you will always be still worrying that something might go wrong. And that feeling gets worse towards the day of laser, which is a very nerve-wracking experience. And I remember that very clearly. And, you know, obviously having treated thousands of patients myself, you would think that I would just be like, you know, just take this in my stride. But I couldn't do that myself. I ended up feeling exactly like a patient and being extremely nervous on the day. I have to say the procedure itself is nothing. You know, it was painless. It was quick. It's an amazing kind of like light show. It's actually a really cool experience to have it. Yeah. It's the kind of couple of days afterwards when your eyes are sore that it's the kind of bit that I didn't enjoy. But the actual laser itself was honestly, I mean, if I had to do it again, you know, for a top-up, I'd have no issues at all with the actual procedure, none.
I was wondering how long the procedure actually takes for me, well, for my eyes, how long you would think?
So for you, it would take about 8 or 9 seconds per eye.
Oh, wow, okay.
And then it's done.
It's a bit of a trivial question, but how long after the procedure could I put things on my face, like do my skincare, makeup, that kind of thing?
Yeah. So, you know, mascara, eyeliner, all these things, they do deposit particulate matter on the surface of your eye and in your tear film, and you see that at the microscope. So it would be great if you just sort of didn't do that for a couple of weeks afterwards and just kind of left that mid-face alone for that time. There was one little thing I did actually, which you probably won't do, but I deliberately, because I was a bit older than you, you know, almost 10 years older than you when I had my laser eye surgery, I deliberately left one eye a little bit short-sighted so that when I got older then and had that presbyopia thing coming on, it wouldn't affect me so much. Oh, okay. So my near dominant eye, I left a bit nearsighted. And that meant that there was a little bit, you know, it took me probably about 3 months to get used to that fully, for my brain to fully adapt. And so people we call that mini monovision. We call that kind of, it's like a distance eye and a near eye, but not massively different. So they're kind of working together, but they're doing slightly different things. And that keeps your vision good as you get older. I think at your age, probably not that relevant a conversation because it's going to be, you know, a good 25 years before that is a thing we have to worry about. Okay.
As soon as the procedure is done, what will I be able to see and how will my vision be? Will it be perfect straight away?
It's variable from person to person. For me, it was a bit hazy. You know, so when you sit up from the laser bed and you look at the clock on the wall, you can tell the time, but it's a little bit blurred. Okay. You know, it's better than it was when you were -3, but it's not clear and sharp. And then what I found in the few days after surgery was that outdoors in daylight, my vision was actually quite good from the outset. A bit more hazy indoors. And what I found really like very blurred for the first few days was looking at a computer screen. Because I was planning to sit at home and just catch up on admin, and I just couldn't. And I just gave up on that. Yeah. But and actually that was a bit nerve-wracking because you know, the sort of day 2, day 3, you think, oh my gosh, is this going to get better? And then it just suddenly does. And that's to do with the way that the surface of the eye heals. Yeah. And it sort of rebuilds the kind of cells in a normal structure. Yeah. It takes a few days to do that.
For my job, I drive a lot, and in everyday life as well. How long after the procedure can I get back to being behind the wheel?
So there's a legal requirement that you need to be able to, you know, approximately take 25 big paces away from a vehicle and then turn around and look at the vehicle, and if you can read the car registration plate at that distance, then legally you can drive, as long as you feel confident to drive. And that's likely to, again, happen in the first few days, but you can measure it yourself.
Yeah. I'm very grateful to all of the Vision Scotland team for giving me their time today. I feel much more at ease about the whole procedure, and a lot of the anxieties that I had about laser eye surgery have now been put to rest. So it's given me a lot to think about when I go home tonight.
With laser eye surgery at Vision Scotland, we restore the vision and transform the lives of thousands of patients every year. Call Vision Scotland today to arrange your free consultation and find out how laser eye surgery could transform your life.